Hello, everyone, and welcome to the IHI Innovation Theater. We're so glad to have you with us today at today's presentation, Advancing Excellence in Mental Health and Well-Being, How Health Systems Can Improve Mental Health Outcomes Through Care, Coverage, and Community, supported by WellBeing Trust. And with that, I will hand it over to Jennifer Graves to get us started.
Hi, everyone. I'm Jennifer Graves, the Grants and Finance Manager at WellBeing Trust, and I want to welcome you to our presentation. WellBeing Trust is a national philanthropy which was launched by Providence St. Joseph Health in 2016. We invest in approaches that advance clinical, community, and cultural change in order to transform the health of the nation and improve well-being for everyone. Our presenters today are Dr. Benjamin Miller, Chief Strategy Officer, Tyler Norris, CEO, Dr. Arpan Wagre, Chief Medical Officer, Laura Blank, Senior Policy Associate, and Lisa Heron, Executive Fellow. So I'll hand it over to Ben to get us started.
Thanks, Jennifer, and thanks everyone for joining. Few events in recent history have had the same potential to impact mental health as the COVID-19 global pandemic. This uniquely disruptive pandemic has maimed the utility of previous playbooks for managing the mental health concerns that come out of disasters and pandemics alike. While the virus continues to impact us in a multitude of ways, including our health, our social connections, and our economy, there are still lessons to be learned. But it's not just the pandemic that's impacted our mental health. Racism, climate change, social and economic factors all together have left us as a nation in pain. Deaths from drug, alcohol, and suicide occur so often, 1 million in the last decade, that there's a name for them, deaths of despair. And the situation may actually get worse. Since 1999, our country's data have been trending in the wrong direction. These deaths touch every part of society. No family, no child is immune. But we can change things. This generational crisis calls for big, bold action. Simply creating new programs to address one piece of the problem is not enough. Incrementalism, as we say, is insufficient. We need true systemic reform. Deaths of despair are directly related to pervasive issues with how the country views and manages issues like mental health and pain. While there's no question that the availability of drugs and alcohol contribute to their use, many other factors also contribute to substance misuse and risk for suicide. These include family and social relationships, adverse childhood experiences, trauma, depressed communities, and lack of opportunity and social capital. We need healing. For a nation in pain, healing requires a multi-tiered strategy, of which one element is policy. This is why WellBeing Trust has brought forward Healing the Nation, a policy guide for our federal partners, as well as a framework for excellence. Healing the Nation is a comprehensive overview of federal policies that can begin to bring us to a place where we address some of our pain points, things like access or wrongly denied coverage. Our structures often reinforce fragmentation. Let's make to work accessing care easier, especially in places like primary care, where mental health has been historically fragmented. Individuals have had to work harder to get the care they need, and often that care is not delivered in a timely or evidence-based fashion. If COVID-19 has highlighted anything about our current delivery system, it's that asking people to come to a clinic or a hospital may not always be the best approach. The pandemic is a prime opportunity for us to rethink the American approach to mental health care in its entirety, to adopt a new vision and create an integrated system of services that reaches into settings as varied as primary care, schools, prisons, workplaces, and our homes. Such a system, though, requires substantial investment. Our framework highlights all the areas we'll discuss today: community, coverage, and care. And as you'll hear from my colleagues, requires novel investments in an aligned strategy. WellBeing Trust has invested ourselves in policy documents to build off this framework. From our federal policy guide, Healing the Nation, that we did with folks like the Kennedy Forum, to a state guide for advancing mental health with our partners at the United States of Care, to the local level in ways that mayors and local health officials can apply the framework that we created with the Beaumont Foundation. And it's within these tools and our framework for excellence that I now turn it over to our second presenter, Tyler Norris, CEO of WellBeing Trust. Tyler?
Ben, thank you for that beautiful overview of the comprehensive approach that's capable of saving lives from deaths of despair and increasing equitable well-being for all in the country. When Providence and St. Joseph Health came together to form what is now called Providence, Dr. Rod Hochman, our board chair and the CEO of Providence, and the Sisters of Providence and St. Joseph said we need to do something significant that is capable of turning the tide on these trends that, of course, have been wildly exacerbated by the conditions and the fallout of COVID-19. They wanted WellBeing Trust to advance the mental and social and spiritual health of the country through building a social movement. And we'll talk more about that in a minute. But more important, given that we were born inside of an integrated health system, was to help Providence be the blueprint health system for the best quality care we could offer our patients, those who count on us to deliver quality every day, to do that at the best possible cost. And in fact, in the meantime, to be able to lower the total cost of care, given the interrelationship between care provision of chronic disease as well as mental health issues. Third, to be able to do that in a way that builds the conditions for well-being in the first place in communities. And fourth, while providing high quality experience and joy for caregivers. That's, of course, the quadruple aim and why we've partnered so well with Institute for Healthcare Improvement. As an independent philanthropy associated with Providence, we have three goals: get the care right, get it paid for, and create the conditions for intergenerational well-being in the first place. In a minute, you're going to hear from Dr. Arpan Wagre to talk about what does it mean to have high-quality, integrated, whole-person care where physical and behavioral health are joined, and the assessment and referral to non-medical needs becomes a standard, where there is no wrong door wherever you might touch the health system. That's a prerequisite, hygiene for the delivery system. Secondly, coverage to increase access to that care through state, federal policy that assures equitable access. And third, to create those vital conditions for well-being in the first place. That's what we're all about. We're excited to be partnering with healthcare systems around the country. And with that, I'll turn it to our Chief Medical Officer, Dr. Arpan Wagre.
Thank you so much, Tyler. And, as we think about this, as Tyler described, our goal, WellBeing Trust, born out of the health system, wanted to create that blueprint, that proof point. Like, how do you do this? With a vision that creates a system that has no wrong door for mental health and substance use care. Truly thinking about this in a way where, regardless of where an individual might seek help, our caregivers are not only willing and able, but have all the resources they need to provide that whole person care. We think of ourselves as whole persons caring for whole persons. So in service of that big goal, WellBeing Trust supported Providence in launching a mental health and substance use clinical performance group. What we did was convened 200 caregivers across 7 states from Providence with multidisciplinary representation, nursing to ED physicians, primary care, psychiatrists, social workers, but population health, community benefits, and really thought about this holistically and created this network of behavioral health leaders that then started a multi-year learning collaborative. And this has been very, very powerful, and there's a lot of amazing stuff that's come out of this. The group decided to focus initially on integrated behavioral health and primary care, substance use across the care continuum. But then, a very fundamental thing was that these combined clinical efforts needed to lead to something bigger. And that was with the vision of zero suicide, that no one will die alone and in despair by suicide under our care. So an area where we found a gap, and that has been a part of the way WellBeing Trust has focused on the greatest way for us to drive impact. So when we thought of, unfortunately, emergency departments being the last safety net for most of our communities, it's the first and only place in many cases for someone to experience, who's experiencing a behavioral health crisis to get any form of help. So we recognized that there was a gap, and the gap was because there were a lot of great health systems doing good work in certain aspects of this patient's journey. But we wanted to look at this more comprehensively. What happens before someone in a behavioral health crisis presents to an emergency department? What happens when they are in an emergency department? And what happens when they're discharged and how do we set them up for success? And this is where WellBeing Trust, in partnership with the Institute for Healthcare Improvement, launched an 18-month learning collaborative with these health systems that you see up there, leading health systems, and we tested multiple changes and created a change package, which is available in the chat box for you to take a look at, and I would highly encourage you to take a look at this. And there might be some components of this that might be relevant to your health system today. And then the pandemic hit us. And, we already had a crisis of burnout among our healthcare workforce. And the pandemic and the substantial demands that this placed on an overly stretched health system, unfortunately, just made things harder for everyone. And WellBeing Trust, realized that these were unprecedented times. And, just simply recycling wellness offerings of the past would not meet the current needs. So we decided that this was an important time for us to step in and do something with others. And we partnered with the Institute for Healthcare Improvement and multiple national thought leaders to create a special series, Caring for Caregivers special series, where we learned and shared information in real time. It was fascinating because we covered topics from transforming moral distress to moral resilience, peer support, fostering connection, destigmatizing mental health, mental illness, thinking about what's the psychological equivalent of your PPE, and so on. And what we did from this was harvested the learnings from all the brilliant people all over the country, all over the world. I would say there were multiple international sites that joined these learning sessions. And we harvested this to create a toolkit where we organized them in very practical actions that can be taken by individuals, by team leaders, and by organizations, not only during the pandemic, but beyond. But as Tyler pointed out and Ben did earlier, we recognize that not having access and coverage is always going to be a limitation. So I'm going to hand it over to my colleague, Laura, to walk through that aspect of WellBeing Trust's role.
Wonderful. Thank you so much, Arpan. And just to build upon what we've discussed thus far, I'm going to focus today on access to the care that we all know is so vital. So even if we do everything we can within the clinical environment to integrate care and connect patients with appropriate mental health services, we still have a lot of work to do to ensure there is access to that care. Though there are countless factors that can impact access, I'm going to talk a little bit about three critical components today: coverage, parity, and workforce. Access to insurance coverage provides individuals with the opportunity to engage in routine care. Without access to these preventive and early intervention services, people present in the healthcare setting with more significant needs, which is detrimental in terms of both health outcomes and cost. We have over 28 million people uninsured in the United States, and that number is likely to grow as a result of COVID and the economic impacts. At both the state and federal level, lawmakers are going to have to grapple with how we provide meaningful coverage for Americans, which is particularly important for mental health needs that are likely to endure long after a vaccine for COVID is introduced. Recent challenges to the Affordable Care Act have many thinking about how we protect essential benefits and ensure that pre-existing conditions cannot be used to disadvantage or exclude people from coverage. With recent increases in reported anxiety and depressive disorder, protecting coverage for those with a mental health diagnosis is crucial to ensure that people both seek care and receive the necessary treatment. In addition to expanding and protecting coverage, we must ensure that benefits within that coverage are designed to adequately address needs. The term parity has been associated with mental health coverage since the passage of the Mental Health Parity and Addiction Equity Act in 2008. This landmark legislation was designed to create equal coverage for treatment of mental health and substance use disorders, but we've not yet realized that intent. Insurance coverage is complex, and most individuals don't have the knowledge or time to understand benefit determinations and address denials. We have to implement processes to ensure that people are receiving the coverage they deserve and have paid for, holding insurers accountable to generally accepted standards of care. There's been some success in advancing parity through legal challenges. For example, the Witt versus United Behavioral Health decision helped establish standards of care for behavioral health services, but action is still necessary to implement and enforce parity. The Parity Act must be applied to all health plans, including Medicare, and states need directive and resources to actively enforce the parity law. A handful of states are making progress on this, including California, which just passed model legislation with Senate Bill 855. Even if we get people covered and ensure that their benefits are appropriate, we need to have a workforce that is sufficient to meet the demand for services. Increasing GME and incentivizing health providers through loan forgiveness and repayment programs are critical steps in ensuring access to care. But those steps alone won't create a workforce large enough to meet the demand. We need to think more broadly about how to expand capacity to meet mental health needs and improve diversity within the workforce. To that end, WellBeing Trust is focusing efforts on 2021 on augmenting our current system of care by increasing training and skills among non-clinical community-based providers to help support those in need wherever they present, and to serve as a bridge to clinical care where necessary. So with that, I'm going to turn it over to Lisa now to talk more about leveraging community assets to help people thrive.
Thanks, Laura. So we can expand access to care coverage and build the clinical workforce. And we also know that people need the vital conditions for well-being in the first place to thrive. And you'll remember from Ben's presentation of our framework for excellence and Tyler's slides that we focus on the 7 vital conditions from housing to meaningful work and wealth. They are the base that informs the work that we do and the partnerships we cultivate, bringing in a holistic and also upstream perspective on the strategies towards mental health and well-being. All of these in some way are connected to our mental health and can lead to stress or anxiety if one is out of balance. The richest and most detailed example from this year is from a partnership with the CDC Foundation called Thriving Together, a springboard for equitable recovery and resilience in communities across America. This is a living document that includes short-term and long-term equitable policy, practice, and investment change in each of these vital conditions, from affordable housing with wraparound services, or more poignantly, eviction moratoriums that are needed right now, to implementation of green schoolyards so kids can get back to learning safely while supporting their mental health and well-being. It has over 100+ contributors, 52 organizations or networks, and we encourage you to explore more at thriving.us. Our contribution as WellBeing Trust to Thriving Together, this springboard, is a complement to what Laura mentioned around workforce. It's community capacity building for mental health and well-being through task sharing. Task sharing, taken from the literature in both global health and here in the States, essentially means empowering lay people outside of the clinic and healthcare with evidence-informed mental health skills and training. The idea is that in partnership with health systems and clinicians, mental health support can be delivered to close to people's homes and with trusted community-based organizations and caregivers while reducing the burden on our already overwhelmed healthcare system. Imagine groups already connecting community, from YMCAs to faith-based organizations, having an added set of mental health training and skills in everything that they do and all the services that they already deliver. So we're working with partners to create an operational plan for scaling up such interventions through 4 key activities in this slide: mapping the path to scale, building the foundation of care, building the leadership capacity in community-based organizations, and developing an accountability and quality improvement plan. And with that, I'm going to give it back over to Tyler, our CEO, and Ben to finish up.
Tyler, you're muted.
You've just seen, thank you, Lisa, that was fabulous. You've just seen us lay out a comprehensive approach to care coverage in community that delivers on the quadruple aim. And with the data all going the wrong way, as Dr. Miller pointed out at the top, we know we need to reach a much greater amount of people and spread and scale the bright spots we're seeing in the clinic and in communities. Our National Advisory Council chair is none other than IHI President Emerita Maureen Bisignano. Many years ago, when I was at Kaiser Permanente, another leading integrated delivery system, we were exploring the way in which Kaiser was working to create dose-sufficient impact in communities. Maureen made a comment that frankly changed the course of my career and direction, which is that when you know that what you are doing as a health system is not adding up to deliver on the quadruple aim, it is unethical to continue behaving this way, pretending as if it will, as if a paraphrasing of that Albert Einstein quote. So with our National Advisory Council, we reverse engineered social movement theory and identified these 7 areas: pathways, communications, policy, funding, leadership, measurement, and standards that every social movement has, whether it's suffrage, the environment movement, civil rights, marriage equality. And we set out very deliberately over the last few years to invest in elements of that movement infrastructure that were missing. Lisa pointed out a minute ago to the Thriving People in Places. We partnered with the CDC Foundation to build out those multi-solvers. We helped build the WIN network in order to bring communities and NGOs together and business leaders together to create dose-sufficient responses to the vital conditions previously known as the social determinants of health. We partnered with Kenneth Cole and the Mental Health Coalition to reduce mental health stigma and help create comprehensive and clear communications campaigns to help spread the word on what can be done to care for self, other, and step up in our communities. Most importantly, we helped build Inseparable.us, the first 501c4 in this country dedicated to addressing those policy objectives that Laura articulated a bit ago. Inseparable was key to helping pass California SB 855 and is helping work in other states and on federal policy with other partners. We even included, with other philanthropies, we helped build something called Mindful Philanthropy, mindfulphilanthropy.org, to help bring fresh resources into the mental health field and invest it in the evidence base of what works. Dan Gillison, the CEO of NAMI, and I convened the CEO Huddle, an alliance of the 14 leading mental health organizations that now have a shared, unified vision that aligns a once fragmented mental health and addiction community behind common pathways for action. Those are just a few examples of the movement infrastructure we've been building that are available to you as health systems. And as you think about what we've been building nationally, that movement infrastructure needs to be built in your community as well. What are those pathways and multi-solvers? How can you align communications in your community? What are the policy strategies, funding, et cetera, to create that dose-sufficient responsibility that is key to us all as healthcare delivering on our missions? With that, I'll bring it back to Ben to bring us home. Thank you.
Thanks, Tyler. So well said. And as you all have heard today, when healthy community conditions, good coverage, integrated care, and inclusive policies are all in place, we can achieve positive outcomes that improve the mental health and well-being of all Americans. This is why WellBeing Trust was started and why we actively look for partners like health systems to help us in our journey. As we have described, accomplishing this goal requires a comprehensive framework that sees mental health as existing on a continuum that begins in community and extends into healthcare. If we're serious about tackling mental health and addiction in our country, we must leverage all the places and spaces people present with needs and provide support accordingly. We must also see needs as inclusive of risk factors as well as mental health conditions and focus on upstream factors that can prevent or mitigate later problems. Let's make sure that mental health is easy to access no matter where you show up, and that our community conditions and coverage options lay the foundational groundwork for our overall collective success and well-being. It all comes back to care, coverage, and community. And tackling these three things simultaneously is both our greatest challenge and our greatest opportunity. Jennifer, back to you.
Touched on the Caring for Caregivers report in his section, but Tyler, can you tell us a little bit more about the Deaths of Despair report before we close?
Well, we partnered with IHI over the last few years on a number of initiatives, and one of them was really focusing on how can health systems do the internal work inside themselves as anchor institutions with their various levers to partner with communities to address those things that are driving the deaths and diseases of despair in the first place, essentially the frame that Lisa brought. Initiatives that have sufficient reach, intensity, and duration, and that leverage all assets of a health system as anchor institution, purchasing, hiring, and investing to sort of have a doubling down alongside community benefit investments is essential to actually moving the needle on these issues. The resource that we developed with IHI and that IHI is now sharing with healthcare systems across the country is available to help health systems prepare themselves to do dose-sufficient work and make a measurable impact on communities and essentially live up to the second half of all of our mission statements and to improve the health and well-being of the communities we serve.
Thank you, Tyler. So if anyone would like to contact WellBeing Trust with any follow-up questions, please feel free to reach out to Lisa Heron at lisa@wellbeingtrust.org. And we're very appreciative of our partners at IHI for making this forum possible. So I will now pass it back to Cindy to close us out.
Thank you, Jennifer. Well, a big thank you to all the presenters and to WellBeing Trust for supporting this session. IHI is extremely thankful for this partnership and so glad they are with us at the IHI Forum, knowing that this work is so deeply important. We hope you enjoyed this session, and thank you again to WellBeing Trust for your support.